Hi, my name is Emily York, and this is my art project final presentation. Um, my vision for my original project would that these individual handouts that you'll see on my poster would represent a canvas put together on a wall, um, depicting the 4 different birth options that are available to women, that we hear about more and more commonly. And then during my start of this project, I found that over the course of the years between 2004 and 2017, home birth rates were on the rise and have almost doubled. During COVID, which would be years 2020 to 2021, they found that over 30 states there was a rise in home birth, anywhere from 8 to 49% over those different states. One subject I'm touching on is the subject of free birth, which, despite my shirt saying free on it, that's a tooth, not anything to do with labor. But free birth is obviously not something that we can really track. So anecdotally, it does seem like free births are becoming more and more either talked about or kind of becoming a fad that you'll hear about on social media, and being promoted that way. So yeah, anecdotally we can say that that is seeming to be on a rise. My artist statement, I did revise it a little bit. So women's health, especially labor and birth, have been under attack for some time, but have recently been making more headlines. Following COVID, and now as labor and delivery units are being closed, families are being forced to make some hard decisions on how to bring their babies earthside. When the subject is discussed, the options are usually hospital or out of hospital for birth. The issue lies with the out of hospital options. People all around us have different understandings of what that actually means. A hospital is a single option, usually with all the interventions possible and available. But with out of hospital, there are 3 options to consider, all with their own options. For some people, out of hospital is a barbaric option because they see it as unsafe. These judgments are made without the understanding of all the guidelines and tools that midwives carry. For some, it's the simple understanding that a midwife and her team are trained medical professionals in mom and baby care. More recently coming to light is the extreme option known as free birth. While every family is entitled to make their own informed choice, this option poses a threat to midwives and their families because a lot of the time, all out-of-hospital births tend to be viewed under the same umbrella and or microscope and should not be. I chose this topic because it has come to my attention the lack of understanding between the out-of-hospital birth options. As midwives, we get asked about free birth and our thoughts about it. My purpose for this project is that should my client ask me or someone in the general public be curious, I would like them to see this and know that not all out-of-hospital births are equal and that a midwife does not mean free birth. I want to show in my project the 4 options, what they each offer and consist of, and having that primary focus in each of those areas be the larger one in the image that you'll see. Personally, when I was having babies, I thought my only 2 options were hospital and birth center. So even in my own journey, I was not aware of the other 2. So I'm going to show you my project. I have the heading is labeled "But Before You Birth," and the 2 top pictures is the free birth option and the hospital option. You'll see on the hospital option that the doctor is the main focus, as are most of the interventions are a lot larger than, say, the informed choice option, which is the icon with the finger pointing at the different circles up above, and the patient in the bed is obviously on the smaller scale. And then in the free birth option, most things are about the same scale. Obviously the family unit is a little bit larger because they're doing what's best for them. And then down below you'll see either a birth center or home option. Pretty much the same. Obviously the biggest difference is one's at home, one's at the birth center. you'll see that the midwife is not the main focus, that our main focus is family choice, and then obviously the informed choice, which is in the upper corner there as well. And the reason I chose that icon for the home birth and home option is because it gives you more options, because we tend to discuss a lot more informed choices and decision making with our families than hospitals do. We also offer doula options. We tend to use herbs more than medication. And we just offer different birthing positions and tools. So thank you so much for listening.